Hello everyone, welcome to my channel Easy Oral Pathology. So my name is Dr. Kansha Srivastava. I am senior lecturer in Dr. B.R. Ambedkar Dental Science Oral Pathology. So today we are going to discuss a very important and basic chapter of oral histology, that is dentin. We will be discussing this part in many parts in order to of ease and comfort. So in this part, we will be giving a brief introduction of dentin, its physical and chemical properties. Now, a dentin is a mineralized hard connective tissue component of the teeth. Now, teeth consist of hard and soft tissue. Okay, so in hard connective tissue, dentin comes under hard connective tissue. It forms the main bulk of the tooth. Now, as you can see that this is a normal diagrammatic representation of teeth, molar and premolar. Now, here you can see that this is the dentin. Now you can make it out that dentin forms the bulk of the tooth as coronally. This is the coronal portion, crown region. In the crown region, it is covered by enamel. This one is enamel, and in the root region, okay, this is covered by and the dentin is covered by cementum. This narrow line is the cementum, and also it is surrounding the pulp. Pulp is in the center, having the nerve innervation. Okay, so since it forms slightly before the enamel, so it also determines the shape of the crown, including the ridge as well as the size and root number of the root. Okay, now dentin is physically and chemically dentin is similar to the bone. Now there are differences as well. Dentin is avascular, means it lacks blood vessels and lymphatic vessels, whereas bone is vascular, having blood vessels and lymphatic vessels. Okay, dentin gets its supply from pulp, nerve innervation sensitivity from pulp. Okay, also dentin do not contain any entrapped cells, whereas bone contain the entrapped cells, osteocytes. Coming on to the physical property, it is light yellowish in color, and this color darkens as the age advances. The thickens from 3 to 10 mm, but thickness varies in the same tooth, whereas it thicker on buccal aspect and thinner on lingual aspect of the same tooth. Now hardness. Hardness is one of the most important aspect of the dentin. So it is slightly harder than bone and softer than enamel. Now KHN. KHN is a Knoop hardness test, which is a parameter to measure the hardness of any substance. So enamel KHN Knoop hardness test is 343, whereas dentin is 68. So you can make it out how much harder the enamel is than the dentin. Also, there is a differentiation in hardness in the primary as well as in the permanent tooth. So, dentin of primary tooth is slightly less harder than permanent teeth. Also, so within the same tooth structure, it is somewhat harder in the central part of the same tooth, whereas near the pulp and periphery, it is less harder. Elasticity. Elasticity also plays an important role as it provides resilient or flexible nature, which prevents the enamel from fracture. Since enamel is a very brittle structure, it does not have any resiliency structure or elasticity nature. Radiodensity. Now, radiodensity is the density of the dentin which is present radiographically. This is a normal radiographic structure of the tooth. So this one is the enamel. Now you can see that dentin is more radiolucent or lighter than enamel. Okay. Now permeability. Permeability means the ability of any substance which allows gases or liquid to pass through it. Now because of the presence of dentinal tubules, which we will be discussing in coming slide, there is the permeability of dentin increases. And because of the blockage of these tubules, sometimes the permeability decreases considerably because of the protective purpose. Now, coming on to chemical properties, we have inorganic material and organic material. In inorganic, 65 to 70% it constitute mainly calcium and phosphate in the form of hydroxyapatite crystal. Now, if you remember, hydroxyapatite is also crystals are also present in the enamel, but here the crystals are smaller. They are present in the small plate form within the dentine. Apart from that, it also contains carbonate, sulfate, calcium hydroxide, and trace element of copper, fluoride, iron, and zinc. In case of organic material, it constitutes 20 to 90% collagen, mainly type 1 collagen. Type 1 collagen is the principal collagen with a small amount of type 3 and type 5 collagen. So it consists of collagenous fibrils embedded within the ground substance. Now, ground substance is made up of mucopolysaccharide. Ground substance are the matrix where these collagen fiber are embedded in it. Mucopolysaccharides are proteoglycan and glycosaminoglycan. Okay. And collagen type 1 act as a scaffold. A scaffold means providing surface area to accommodate more portion of minerals within its holes and pores of the fiber. Now, there is also a fractional inclusion of some non-collagenous matrix protein, which is present within the space, which is present within the space between collagen fibers and accumulate along the periphery of the dentinal tubules. These non-collagen matrix protein will be discussing in coming slide, and also lipid is present. Water is also present by 10 to 15%. So these are non-collagenous matrix protein which fill the space between the collagen fiber. The main function of these collagen fiber is to regulate mineral deposition. Means it can act as an inhibitor, a promoter, or stabilizer, and helps in the distribution of dentinal tubules. Now, here there are two proteins which is present only in dentine. First one is dentine sialoprotein, which is present only in dentine and not present in enamel, and also DPP. DPP is dentine phosphoprotein. So these are also non collagenous matrix protein, same with the same function. Now, coming on to comparison between enamel and dentine. So, we all know that enamel and dentine both are the harder structure. Okay, dentine is somewhat less harder than enamel, but there are other differences as well. Enamel is ectodermal in origin. Okay. It is formed by the ameloblast cell, whereas dentine is ectomesenchymal in origin, and it is formed by the dental papilla. Odontoblast cell, which is derived from the dental papilla or pulp. Enamel has a limit formation of limited period only, whereas dentine forms lifelong process. Enamel has a high mineral content, 96%, whereas dentine has 65%. Hydroxyapatite crystal are larger, whereas apatite crystal are smaller. Now, apatite crystal are the calcium deficient carbonate apatite. Okay, so here apatite crystals are small and dentine. Organic content is unique with enamel protein. Collagen is absent. Here, in dentine, collagen is a main organic compound, mainly collagen type 1. It is a non-living tissue and do not contain cells or cellular component, whereas dentine is a living tissue because of the presence of cytoplasmic extension of odontoblast or dentinal tubules. It do not respond to the stimuli as it is the non-living tissue, whereas dentine is respond to the stimuli and have the capacity to repair and regenerate. The crown enamel is found only in the coronal region, whereas dentine is found both in crown and root. So this is all about dentine. In the next session, we will be discussing about the structure of the dentine. So thank you very much. I hope you have understood the topic. Don't forget to like, subscribe my channel.